much, and good morning. Assalamu alaikum to everybody. This is Dr. Raza Siddiqui, and I am the panelist today, and it's a pleasure to welcome you all as a moderator. Let me give you a brief background about myself. I spent 10 years in pharma marketing, 7 years as a fashion designer, cosmopolitan, and 30 good years I've been running healthcare institutions. Uh, My last job before coming to UAE was head of Apollo Hospitals in India. So I came here in 1998, 27 years ago. The subject which we are talking about now is very close and very dear to my heart because I started on this journey 27 years ago. I came here to open first Apollo Hospitals here and start medical tours in UAE. And during that period, I realized how the transformation of healthcare has happened in the region. Because that time when I came here, more than $10 billion were being spent on healthcare abroad. Large number of people from entire GCC and African countries were traveling mainly to US and Western countries. The transformation started happening after the unfortunate September 11th incident. People from this region were scared to go, and also they were hesitant to take them to us. And from that time, I've seen the transformation of healthcare in this region. The credit goes to the wise leadership of this country, which has played a key role in this transformation. The model was US model because US is my government, and US realized in early 60s that healthcare cannot be the responsibility of the countries or nations because healthcare is technology, capital, and skilled manpower intensive. So healthcare has to be somebody has to pay for this. In 60s, US privatized healthcare and created accessibility bridge to private insurance. Two responsibilities of the citizens, which were the retired population and unemployed people, were covered with Medicare and Medicaid. So this country learned from the best model, and I have a lot of colleagues sitting here from UK who know that whatever best NHS has done is facing a lot of challenges. So the long message, short message is that healthcare has to be for profit and somebody has to pay through channels. So this is the transformation I've seen here from the country where hundreds of people were traveling abroad. Today has become a destination. More than 1,000 patients every day come only to Dubai. So we are seeing more than 400 to 450,000 patients coming into UAE today from outside. A country which was spending more than $4 billion a year has started to reverse the trend. On this note, I have done enough introduction about myself. I will try my fellow team members to give a brief introduction about themselves. So I will start with Kathy.
Good morning, everyone. So a little bit about myself. I think people would describe me as borderline annoyingly curious, but I blame my father on that. He was a respiratory physiologist. Some of my earliest memories were on road trips. We saw a roadkill, a dead porcupine. He would pull the car over and he would teach my brother and I how the body works that way. So it was no wonder that I got stuck in school as a physiologist for 10 years. So I love the human body, but what I found the most curious was people's stories. People who know why they needed to take medicine or they would know why they needed to exercise, but they wouldn't do it. So that's why I became very curious in the mind and ended up doing more school, which is another story for another day. But that's a little bit about me. Wonderful to be here.
Thank you, Dr. Katherine. Dr. Mandeep Singh. Yes, please.
Good morning. My name is Mandeep Singh. I'm a fetal medicine and consultant and a fetal surgeon. So basically, I look after babies before they are born inside the womb, and I'm a fetal surgeon, so I operate babies when they are 24, 25 weeks and then leave them behind and then they are delivered at whatever stage they are. I am also a healthcare leader, so I did my training in the UK. I went into management with Professor Tahir Akhtar in the UK. Was a medical director. I moved to the UAE 3.5 years ago into a leadership role and then experienced healthcare both as a clinician and as a leader. And I have insight into now other systems. That was the reason for moving into the UAE. As Dr. Saeed said, experiencing an alternate healthcare system because NHS is a completely public funded system, whereas UAE is a insurance based system, or you can call it as a privatized system. So we interested to discuss how East and West are now meeting and what is the value of each system that it provides to the system in general and to the people that it serves.
Thank you, Dr. Mandeep. Can you go to Reem, please?
Assalamu alaikum. My name is Mahrat. I'm founder and CEO of EazeBio. I'm chemical engineer by training and I have over 20 years in biotech industry. I had founded multiple companies and led three to successful exit. And EazeBio actually wasn't just born in a lab. It was born from my own health journey. We believe that really tracking your health does not require a PhD or doesn't have. So think about it, it's at your home, on your phone, with science that's speaking human. We combine the power of AI and biomarker and we develop a point of care diagnostic accessible from home, and also some other panels can integrate with instruments for deep clinical insight. Together, our, our instrument fleet and the clinical based health panels, we created a platform that is adaptable, accessible, affordable, and really allowing us to make healthcare basically available everywhere in the world. Thank you.
Good morning, everybody. Tayseer Mustafa. I am a medical doctor, working career, professional training, specialized in occupational and environmental medicine. I'm also an entrepreneur. I'm the CEO of Ocean Six, which is a management consulting company in APG in Abu Dhabi. I'm also the chairperson for SMA Group, which is the oldest conglomerate in Sudan. Our company, it's started in 1908. From a very early age, I decided that we are in a world that we really need to look after each other, and that's why I chose medicine. And very quickly, I understood that I need to do more, just like not only seeing one patient at a time. I thought I could do more, and that's why I chose my specialty. And then eventually, I also decided that we can still do more. And that's why I went into technology. I was the tutor for the specialist doctors in Ipswich Hospital in England, where I trained. And I have done the first pilot of training in which the surgeon was in Ipswich and the mentor was in France. That was a big thing back then. It was done in 2009, so many years ago. We also started the Doctor of the Deaths in 2010 by another group, which was the start, I think, of the telemedicine of today. I also thought we can still do more. So, and we live in one planet. So I've always thought about connecting everywhere because we live in one planet anyway. I'm very involved in obviously Sudan, where I come from, and the mother continent, Africa. And I totally believe that we are all connected, and innovation will even connect us more. Thank you.
Dr. She, we have Dr. Mask online. I think he's in Riyadh. Are we connected to him? Dr. Mazin, please. Can you hear us? I think the connection is not on. So let me start with Dr. Mandi. Dr. Mandi, you've been here some time, and you have witnessed the local healthcare system. You have seen to some extent the evolution of healthcare system here. I would like to share your experience here, and also how it compare with your previous experience.
I think you rightly pointed out in your introduction that every healthcare system has three components. One, the hospital, the buildings, technology, and the workforce. And UAE has an excellent combination of all the three. Uh, it's got a healthcare system which is completely privatized. Having an insurance is mandatory. Obviously, based on the type of insurance you have access to every hospital. So, in that sense, access to care, access to high quality medical workforce, and access to the best technology is all available within the UAE. And I think that's one of the highlights of UAE across the world. I have traveled across the world, including South America. I cannot name a system that can as well equipped as the UAE. Obviously, there are challenges, and we'll cover that in the discussion. But I think it's got all the right framework to be an excellent healthcare system.
How do you compare it with your previous NHS experience?
So the NHS was a completely funded, publicly funded system. Roughly around 6 to 7% of GDP of the UK is spent on healthcare. And if it goes this way, by anticipating that by 2035, the country will be spending around 20%, which is unsustainable. That is the reason why the healthcare system is not performing as well because we cannot afford healthcare. Healthcare is becoming extremely expensive because it is progressing very well. And in the UAE, there is a small part of government funded system for people who cannot afford, but majorly it's funded by the insurance. And that's the main difference. Uh, Obviously, in the UAE is more open to healthcare professions from different part of the world. UK is more restricted with regards to the licensing. I think these are the two major differences.
So coming back to a very important subject, because private healthcare, and it is very important for everybody to pay attention, is the most hated subject in the world. Surprisingly, because people think we are here to make money out of vigilante. So that perception has to be set right, because healthcare is technology, is skill set, and capital intensive industry. Because as a nation, one has to get the latest and the best. What is relevant today may not be relevant tomorrow. Yesterday, there was a single slice CT scan. Today, we are talking about hundreds of 500, 600 slice CT scan. When one goes to a hospital, it is a matter of life and death. You want the best. So the hospital cannot afford to say that once upon a time I was world class, but unfortunately I have not been able to efficiently run my business, so I'm world class. So that paradigm shift in thinking process has to happen. It has to generate enough funds for itself to keep update and keep pace with the changing technology and times. That's the very important message, Dr. Mandeep. Thank you very much. And, as I said, all thanks to the leadership of this country, which has played a significant role in transformation of healthcare. From exporting patients from this place to importing patients here. The role of leadership is the key because the commitment of quality, patient safety, efficiency of the leadership is very important at the organizational level and at the national level. I would want Dr. Katherine to come in at this stage and tell us about, share about your experiences of the importance of leadership.
Sure. I think I'm saying preaching to the choir here. We all know the importance of AI, but that at the end of the day, you have a human that's typing on the computer. My curiosity, getting back to that, is innovation. Technology is built off innovation, but the mindset behind innovation has to be I guess, in a comfortable environment. So I'm really curious, but how can we support people to make more mistakes? The leader of co-founder of Netflix escapes the name, but he said there's no such thing as a good idea. All innovation starts from bad ideas and it's only through trial and error. So I think, especially when it comes to healthcare and leadership, we have to foster environments where people are curious. They're okay with proposing an idea. I mean, how many times have you been in a meeting where you have an idea, but you're like, should I say it or not? We have to foster these environments where people are comfortable and confident to share ideas.
Thank you very much. That's good. That brings me to the core subject of healthcare, and I hope you are ready for that. Okay. Reem, when we talk about healthcare, we talk about quality, we talk about patient safety, we talk about efficiency, because anywhere we go for any application, these are the three things. But when it comes to real time patient experience, the efficiency is very important. Today, we are talking about technology and enablement because healthcare both has got some challenges. Cost is a very big factor, and cost is a result of inefficient systems. And in systems, the most important thing is Dr. Kareem was sitting here to understand the importance of quick diagnosis. And with the help of once you make a quick diagnosis, then only you can have proper policies and treatment plan based on based on international best practices, based on evidence-based medicine practice. You are into diagnostics, and you have brought a lot of new elements. You have brought some new things which help us in diagnosing very quick. So I want you piece of that, please.
Absolutely, yes. More than 80 trillion a year actually go to chronic disease. I mean, it's really sad. And most of those actually could be preventable. But the problem is we catch those at really late stage because our diagnostic system, as we stand today, very reactive, one size fits all, and normally we miss those early signal that, especially in women health and mental health, where actually we can change the story entirely if we catch those early. So with the EazeBio, we rewrite that story. Our AI platform allow you to be able to detect those silent signal early on, even before symptom appear. And this is what we call precision prevention. It is personalized, as you said, it is predictive, and accessible from home. So basically, what we're trying to do, adding not just years to your life, we want to add life to your years. That's the future of healthcare. Thank you.
Thank you very much. You know, on the diet part, earlier we used to build God giving a lot of wealth. But over a period of time, the prayer has modified. God, please give me good health to be able to enjoy when I have it. And I think that the most important thing Dr. In is prevention and early detection. We are in a blessed country. The rulers have so much foresight but cannot even visualize. We spend close to 4.5 to 5% of GDP on healthcare today. And you will be amazed. This is first time in the history of the world we have a dance and it is going to be doubled. And the most of the expense is going to be on balance and prevention. The foresight of this nation's rulers is unimaginable. So this country is not only going to become the best place to live and work, but also for wellness, this country is going to play a very, very important. So in times to come, it is going to be 8.5% of GDP, which is going to be spent on healthcare and mainly on wellness. So the message is very important that prevention is the key. And actually, COVID has made us learn this lesson because people who had good immune system, who had good immunity, they could manage to survive. I don't in the hands of Almighty God, but they were the people who could manage it well. So, Dr. Reem, I think you have a very important role, and the message has to be go across that what is the importance of fighting infection. Now I come to Dr. Nasir, very important, Dr. I think very important. You know, healthcare international has got five challenges: aging population, burden of chronic diseases, cost of healthcare going up, insurance controlling price, and shortage of skilled manpower. And Dr. Nasir, it's very important here to discuss that in US, 70% of healthcare budget is consumed by the chronic disease population. 70%. Now, I was reading about yet what my grandfather has here before. You have done a great job in remote monitoring, telemedicine, and home health. Now, the best solution available is that this population would be managed at home hospital. This will be helpful for future. Current technology very us. Remote monitoring managed by AI, telemedicine managed by AI, home healthcare, this population would get away from the hospital and it would be very well cost effective. I don't want to tell us more about what on you do this week.
Okay, actually, you have touched a very important topic for everybody. From my point of view, we definitely have two ends of the spectrum here. We have the aging population from one hand, which is going to benefit really from technology, remote care, AI technology, and even, proper management, maybe at one day and not very far away from today. It could all be down to technology. Then we have the other end, which is the preventative side. And this is really, I take it from what we eat, what we breathe, what we drink. So this will connect everything together, if you see what I mean, from the point of view of development in all spectrum, especially agriculture, especially water, air quality, and all of that. Again, the technology is going to play a very very important part in that because there are challenges on either side. And again, we are referring to technology like precision agriculture, and now we're seeing the vertical, agri businesses all over the world, especially here. So I believe technology is the way forward. Certainly, we are going through a big change in our lives today. I kind of resemble it to the era where the penicillin was invented. Because now our look to medicine is different. And even the doctor and the physicians are not going to be the same way we are perceiving them today. We're going to have the hybrid doctor. Hybrid doctor is not going to be there at only physiology, biochemistry, the traditional stuff, but he's going to be, and already he and she they're going to be learning a lot more about the technology. So, regarding the price, again, that's something that technology would help. There are so many uh, things that are already present. The remote care. With the AI, it's even going to be cheaper. The issue here will be the scalability and how we convince, you know, investors as well as healthcare providers themselves, including doctors. I think one of the main challenges we have are the mindset. That's what we need to look into. We are finding some challenges in accepting technology, especially in mental health, for instance. because people are frightened, oh, it's going to take our jobs. And in my opinion, no, technology will never take the jobs because the human brain will find something more complex to deal with. And this is what we are here for, I believe. Then we come to talk about connecting all the dots together. When we talk about AI, technology, when you think about it, we are thinking in two dimensions. We think software, we think structure, like data centers, we think hardware. And again, this will bring us back to how are we going to support this? So we will find two great elements, super, super important everywhere in the world, which is basically energy and connectivity. Because these are the things that we really need. And when we come to this, okay, you will find that we will come back to the what we have, raw materials for manufacturing, chips, uh, different kind of connections, so panels, etc., etc. So you will see that everything is connected. Okay. Now here, the most important thing here is the regulations. Here we have the ability to experiment more, and I think we have to balance again between regulations and deregulations to get the right quality to scale up a lot of these inventions.
Thank you very much. Can I agree, Dr. Mazin? No? No. So, final note, it is very important to understand that healthcare has to be run for profit. And when we talk about profit, we talk about business opportunity. Business opportunity is the industry is one of the largest industries in the world. Today, we talk about around 13 to 14 trillion dollar industry worldwide, and it is one of the largest employers because one point gives employment to 8 to 9 people. When we talk about healthcare transformation in the region, there is a great opportunity for this business in this region because the population of EU is going to double and we will require more than 12,000 beds in the next 10 to 15 years. We will require 22,000 additional workforce for that. And I always give example to people and compare it with the hospitality industry, which is very famous here. Everybody spends invests 85-star hotels. So the message to business owners here is very important that healthcare is one of the most important non-oil economies for the country because the cost to do one hospital bed is equivalent to a five-star hotel. And the EBITDA of the hospital and the five-star hotel is almost same. So there is a great opportunity to invest in healthcare, and this country ultimately is going to become a medical tourist destination for the world because of the infrastructure, hospitality, friendliness, safety, security, and over and above, the international quality of healthcare which is coming now. As Dr. Mandeep said, this could be compared to the best places in the world. We are talking about technology. This is the country where the adoption of technology is the fastest. We are not only talking about AI, we are talking about generative AI being used in healthcare facilities now. So this is going to become one of the top quality international hospitals with cost efficiency supported by technology. On a final note, if anyone wants to say,
Well, I would say I think people um, shouldn't be afraid of technology. It's here to stay. And I think here we are in the right place in the UAE for such developments. And in the coming 5 years, we are going to see incredible innovations that are going to be changing the world in terms of technology. In terms of medicine, we are also going to see different changes because we are definitely switching from the normal pharma to the personalized cellular medicine, which is going to be the way forward. Thank you.
So thank you very much. The global healthcare transformation is going to happen here, right under our nose. This country is going to become a destination for the world, including a lot of Western countries. Thank you very much.